All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, community pharmacist of the world. So we're going to get right back into the supplements here. Just wanted to send a big shout out to Anthony Shacklett up there in Louisville, Kentucky. What's up, Shack Daddy? RoCap 86. So shout out to the bros with Founders Day coming up. Let's get back into turmeric here. This one is a very good supplement for those of you, again, who are suffering with arthritis or inflammation of any sort. It also has a little bit of a blood thinning capability. So if you have issues with clotting, this may help you out a little bit. Probably a little cautious for people who have sensitive stomachs. So I recommend that you take this with food because it is really good. Looking at another one here may be of interest. We've got one called Lydia Pinkham. And so for those ladies, those of you who are out there going through menopause, who have heavy menstrual cycles, those of you who are premenopausal or deal with PMS, this is a good product for you. This is about a 8 to 10 herb combination. And this was formulated by a lady named Lydia Estes Pinkham over 200 years ago. And Ms. Pinkham put this product together because she was too embarrassed to talk to her doctor about some of the menopause symptoms that she was going through. And so if you're going through night sweats, if you're going through mood swings, if you are going through hot flashes, this is the product that you want. So we sell a lot of this stuff. It has done very well with our patients, and I've even had some tell me that it's keeping them from killing everybody, just because it does calm down the mood swings. So Lydia Pinkham is a very good product. So if you know someone dealing with PMS or someone who is perimenopausal, menopausal, and postmenopausal, I recommend this product to them. And then let's see here. I guess we can go and talk about beetroot. I guess we won't. All right, so it looks like we've got, for those of you, since we were talking about inflammation, I did want to bring up the hemp oil here. Now this product is gold right here. So if you are having different types of chronic pain, if you have neuropathy, if you have inflammation or arthritis, this is a product that you'll want. In fact, we let people sample this for free every day. So if you're in chronic pain, if you know someone who has arthritis, or if you know someone suffering from neuropathy, send them by Pruitt's Discount Pharmacy or Pruitt's Pharmacy in Antioch, and they can get a sample of this for free. Hemp is very good. Now, a lot of people tend to think that it is marijuana. It is not. It's more like a cousin plant to it. It is in the cannabis family, but not like marijuana is. So the difference between marijuana and hemp is marijuana is low in CBD, but high in THC. So hemp is low in THC and high in CBD, which is cannabidiol, which is the compound in hemp that gives it probably most of its health benefit. Now, hemp has about 100 plus compounds, and each one has a different function. Everything from strengthening the bones to bolstering the immune system, one for sleep, one for neuropathy. So hemp is the product. Now, with CBD, the difference between CBD and THC, with THC, you get more of a psychotropic effect, and so that's what gives you your high. And so many people, mistakenly think that they'll get high if they take this, and you won't. You will get a calming because there is 0.3% THC, which is the most that the law will allow. So you don't have to necessarily worry about failing a drug test or anything just because of the minute amount of THC in it. But you will get some of the pain relieving benefit of THC. So CBD, the difference in that and marijuana or weed as we call it, what happens is when you smoke marijuana and you become paranoid, that is because THC pushes up your dopamine. Dopamine is a feel-good chemical. Anytime we drink alcohol or do illicit drugs, that's what pushes up our dopamine. It's also the neurotransmitter that's implicated in schizophrenia and bipolar disorder. So what we want to do is not add to the THC because it's going to make you paranoid. We want to give you something that's going to pull down that dopamine so that if you are suffering from schizophrenia, bipolar disorder, or anything like that, that you can function better. And that is what hemp does because CBD does that. Pulls down the dopamine, but increases serotonin. And so it gives you an antidepressant effect, but pulls down that dopaminergic, that dopamine, overexcited, stay up 3 days, hearing voices kind of effect. Hemp is some good stuff. I let people sample it, and I'll tell them to take a drop, put it up under the tongue, and they feel the results usually within 1 to 2 minutes. So I think 99% of the people that come in and we let them sample this stuff, they usually wind up buying it because it works very quickly. Likewise, we have a cream, a hemp lotion, because we know that some people don't want to take a mint tasting oil. So we have a cream that does the same thing, and you can just rub it on whatever your problem area is. And sometimes I may have to rub it on, my knee or my back. Just because you have inflammation there. So you can come by and sample the hemp lotion as well. The other thing about hemp lotion is, what I like about it is that it can also deal with dermatological issues. So if you have some sort of dark spot, it can help to clear that up as well. So we have people that use the hemp lotion for that. So remember, guys, free sample of CBD if you've got chronic pain or inflammation. Just come on in and get some here. And it looks like we've got a question here on the web. We got James McClellan out there. What's up, James, out there in Facebook land? And he is asking, what do we use for high blood pressure? So we are going to talk about beetroot juice now, since we can segue on into that. So James, since you're watching out there in Facebook land, this is what we use for high blood pressure. This is organic beetroot juice. And what it does is it contains lots of organic nitrates. And what organic nitrates do in the body is they cause a process called vasodilation, which is it opens up your blood vessels. So when you have high blood pressure, you have your veins, your arteries are shrunken, and they're small, and so it's hard for the blood to get through. So your heart has to pump very hard to get all the blood through to your organs and everywhere else, so you'll be able to move and stay alive. What happens when you take beetroot juice is it mimics the action of some of your blood pressure medications, and it relaxes those vessels so they're able to open up and invite in more blood flow. Now, once you do that, the heart recognizes it, and it knows that it doesn't have to pound as hard anymore, and so it begins to slow down, which the biofeedback, it means it's going to lower your blood pressure. We got started selling a heck of a lot of this when a bunch of truck drivers came in when I first opened, and they said, "Hey, Doc, we are on blood pressure medicine, but we're still failing our DOT physical, the Department of Transportation physicals. They require you to pass certain health requirements with regards to blood sugar and hypertension and all that." So these guys were on medication, but they still weren't passing. So I put them on beetroot juice, and they all passed. So this really took off like wildfire in the trucker community dealing with DOT physicals. Now, since then, it's spread to everybody. And so, James, I would recommend that. Something else you can use too, James, is called coenzyme Q10, CoQ10, which also kind of works the same way. So you can take CoQ10, about 100 to 200 milligrams of that. For those of you who are on statins, you should probably be supplementing with that anyway. Okay, but look, it looks like we're on another break, so you all stay right there. We'll be right back. Keep those questions coming.